You're listening to Health Innovators, a podcast and video show about the leaders, influencers, and early adopters who are shaping the future of healthcare. I'm your host, Dr. Roxy Mooney. Welcome back, Health Innovators. Today's episode, I'm sitting down with Dr. Angela Fusaro, who is the founder of Physician 360. Welcome to the show, Angela.
Thank you, Roxy, for having me.
It's good to have you here today. So I always like to start off the episode with having you tell a little bit about yourself and what you've been innovating these days to give our audience a little bit of context for our conversation.
Absolutely. I'm an emergency medicine physician. That's probably very relevant to how my journey in entrepreneurship started. In that capacity as a frontline healthcare worker, you're really seeing the best and worst of humanity every day, and you're very familiar with the gaps in healthcare, especially around access to care and care that's convenient and cost effective. And so it was really through that lens that I was motivated to start Physician 360. What we do at Physician 360 is essentially we partner with community pharmacies and empower them with tools like access to on-demand telemedicine consults and rapid test kits so that we can transform them into functional urgent cares. And in doing that, we allow patients to have really increased access to care. And most of my innovation these days centers around that. At least professionally. And then in my personal life, I do like to MacGyver gadgets for all kinds of different challenges, but that's probably not the focus of today's conversation.
So hopefully we'll have time to talk treehouse at the end of this conversation. Yeah, that'll be fun. Why community pharmacies? What's happening there? There's so much happening in the marketplace with virtual care, with telehealth. And so why are you kind of linking arms with the community pharmacies? What's happening?
It's such a great prompt because our relationship with the community pharmacies is something that makes us decidedly different than other traditional telemedicine companies. Mm-hmm. And I think it probably is worth noting first that one of the most awesome thing about community pharmacies, there are many, many amazing things, but one of the most impactful parts of their structure is their footprint. So there is a community pharmacy within just a few miles of over 90% of Americans. So when you start to talk about how do we really meet patients where they're at, in all these different types of settings, not just urban, cities, but also like really suburban or even rural America in tribal communities, there's a community pharmacy within a few miles of all of those different types of people and patients. And so that was a large motivation for us to say, we've got the infrastructure, we've got this footprint. How do we empower them with these tools so that they can be not just a place where you fill your medications, but also a place where you can actually get care and comprehensive care, because pharmacists are seeing patients more often than just about any other stakeholder in the healthcare system. So when you talk about who's really going to be there to identify, undiagnosed or subclinical symptoms, for many people, it's their pharmacist.
Yeah, and in one of our earlier conversations, you had mentioned that they're, really underutilized in the healthcare continuum, and I couldn't agree more. There's definitely a lot of opportunity for the community pharmacies to kind of reinvent themselves on how they're going to serve those local communities. So it sounds like what you guys are doing is a good pathway for them to do that.
Thank you. Yeah, I think, in some ways it goes without saying that COVID has really brought light to what you just highlighted, because up until the pandemic, I do think that we really, I wouldn't say marginalized, that might be too strong, but we definitely underutilized pharmacies. And I think COVID made us realize we have to leverage them in a more efficient and in a more comprehensive way in order to get everyone access to care. And so, using that initial use case, which to some degree was out of necessity, but it forced us to see the true potential of community pharmacies. And so hopefully we can get them to function in a much more robust way, which is, similar to models that are occurring already in other parts of the world, like, Europe and South America, where your pharmacist can truly function as a clinician.
Mm-hmm. Yeah, absolutely. So let's talk about COVID and how that affected your business and your commercialization strategy.
Sure. So, pre-COVID, so this, going back to the end of 2019, we were already in the market. We were working in all 50 states, with, hundreds of pharmacies, with a real emphasis on other time-sensitive conditions. So we were doing testing and treating for strep, flu, urinary tract infection. So it made sense when the pandemic started that we would parlay that expertise and the infrastructure into playing a meaningful role in the pandemic. I will say that it just with anything, there's some headwind and some tailwind that came to us specifically from COVID.
Sure.
Yeah. I mean, we had a significant amount of growth just because, again, telemedicine and remote diagnostics got highlighted as this is the foundation of how medicine will be practiced going forward. But on the flip side, part of the trade-off there is that for an entire year, any customer that we interacted with, saw us through that lens also, right? So they saw us as, oh, you're the COVID testing company, or you can bring this type of resource to me as a pharmacist. But it was all around COVID. And so there has definitely been for us some heavy lifting now that has to go into being it worked for you for COVID, understand the value and the other use cases where this is translatable.
Yeah, so it sounds as though kind of revisiting your messaging strategy, brand strategy, and maybe even a lot of your sales strategy has to be iterated in order to adapt.
Absolutely. We, going back to April-ish of 2020, we rolled out one of the first testing programs in the country for COVID. Again, that was awesome in that we could become a thought leader in that space. But yes, we did have to completely revamp for the purposes of 2020 a lot of our messaging and our like you said, our brand strategy, and then subsequently have to do it again in 2021 as COVID starts to normalize and it becomes just another part of that suite of tools. And so there was definitely things that changed for us. Some were very granular, like pricing strategy and how do you bundle certain products together, and then some was much more global, just making sure people understood that what we had really built, the value of what we had really built, was in this comprehensive platform. It wasn't just as a X, Y, or Z company or this type of product company.
Sure. Yeah. I think it's important to kind of dig deeper into this because I think a lot of our audience has faced that as well. Not that they become completely different company, or maybe some of them have, depending on whether it's a big pivot or a little pivot. But, a lot of companies have, were offering the marketplace or offering a different customer segment, something prior to COVID. And then with the changes in the market, having to adapt or wanting to adapt to be able to leverage new opportunities that were before them. And then are still kind of, like you said, at this point of trying to figure out, do they go back to who they were? Are they what they were, just how they were defining themselves and presenting themselves in the marketplace during COVID? Or are they something altogether different for 22 and beyond?
Yeah. I think every company is going through that, even when there is no pandemic, right?
Right.
So you're constantly presented with opportunities that you have to figure out a way to triage, because every opportunity has an opportunity cost also. And so I think this is a problem that companies, especially startups, face in general. I think the pandemic really accelerated that. It was this massive jolt. So you had to figure out, like you said, identity through every phase of it. For us, I think it is important to have, at least the way I approached it, we had a core vision, and that compass or that roadmap was really not going to change in the setting of COVID. Now, if it meant that core vision, this wasn't the case for us, but let's say our core vision was around a business that just couldn't survive COVID, then I think coming out of it and being a decidedly different business, that's kind of a whole different ballgame. Right. But as far as how do you weather the storm of COVID, I think it's you lay the foundation of this is the core business, this is the core vision, and that compass isn't changing direction. And then you figure out what parts of that vision are translatable in COVID. And so for some folks, it's a little bit easier. I mean, I recognize that we're already doing telemedicine and remote diagnostics. It made sense to translate it. very directly to COVID. But I think if you find yourself too off course from that core vision, when you reemerge, you don't have the foundation, you don't have the right talent, you don't have the right infrastructure to really then scale beyond the acute issue.
Yeah, and I think that that's a challenge that's worth us talking about. I like to call it like shiny opportunity syndrome, right? Where, there's just what you're describing is that when you have a vision and a mission and you're kind of, that's the anchor for your company, you can use that as a lens to determine those pivots and the direction that you're going to take the company. And it's not necessarily a bad thing if you decide that we are changing the mission and the vision and we are intentionally being something else versus if you're just kind of getting washed away with the waves of COVID or the waves of those market trends or even changing customer demands, and that you don't really have that anchor to say this is who we are. So then we're kind of get really lost. I see this happen often. Like now all of a sudden I'm having an identity crisis and I'm talking to different customer groups and I'm one thing with one customer, another thing with another one, because I'm just really not sure which one they're going to want to buy. So I'm throwing it all out there. So I think it's good that you brought that up, and it's good for us to talk about it because I do think that is a challenge that a lot of people wrestle with.
And again, I always want to acknowledge, like, I'm not trying to be hypocritical. I think every company needs to go through that to some degree, right? It's that constant iteration, the constant pivoting. But I think without that North Star, I think is, what a lot of people call it. Without that North Star,
Right.
It becomes, like you said, too easy to wake up one day completely off course without the right tools to scale. So.
Yeah, a guest that I had on the show a while back was talking about that, where they came to, and it wasn't COVID related. This was prior to COVID, where they had been presented a number of different investors or board of directors or customer segments that was luring them in a different direction. And about a year and a half into that different direction, they just kind of like looked up and said, that's really not the business I want to be in. It could be a viable business and a great business, but it's not really where my passion and my purpose lies, and decided to completely go back to that original mission and vision and was kind of rebuilding and more anchored to who they were and how they wanted to impact the world. Yeah.
It's also, I'm glad you brought up passion, because I think as a founder, and I'm sure, many entrepreneurs hear this, like, you have to have passion to be successful. And I think that's absolutely true. If you don't have something that is purposeful enough for you, that you think is, related to your maybe individual mission and purpose here on this earth, it's hard to get up every day and like struggle in the grind. On the flip side, if you don't balance that out with enough flexibility to listen to what the market is showing you and to see some of these required, branch points and to make optimal decisions at each of the branch points, you're going to be stuck in too inflexible to a model that might not be able to grow with the market. And so it's like with so many other things, the perfect balance of those two: passion for the ultimate vision, but then flexibility in how it's executed is, I see that in myself and my own challenges time and time again.
And it's easy, right? You just,
Yep, super easy, just like every other part of this.
Oh man, I wrestle with that as well. It's that balance between this wild, pioneering vision to change the world with this unique idea that you have, and how do you stay true to the crazy that's really going to change the world, versus listening to the customers and going, what, they actually trump everything that I think and believe in so many ways, because I can be right, but if no one's buying it, I'm not going to have a business.
To that point, and this is not something that I had done, I didn't have the insight about this until we were further down the road, but I think specifically having a product roadmap, even if so much of it is completely aspirational from day one, I think helps to keep a focus on that, right? And then having the discipline, if you're looking at your product roadmap and you're supposed to be at point one, having the discipline at point one to not get overwhelmed to rush to point two and three. I think it would be that is the trick is, yeah.
Yeah, yeah, absolutely. Get the first iterations of the product out into the marketplace, and then build on it as you go, and kind of get sales and revenue in the door, right?
Absolutely, and learn from that initial use case. I mean, it's something that again we struggled with too, in part because of COVID. We were perfecting one thing, and then this opportunity for COVID kind of blew up in our, in a good way, blew up in our face. Do we follow the
Yeah.
direction of this opportunity? And I think the right thing to do, which we did, was yes. But the trade-off of that is, in the ideal world, I think you take one use case, you take one part of your product, you take something that you can really iterate to quasi to perfection before then you start building on top of it. And so, yeah.
Hey, it's Dr. Roxy here with a quick break from the conversation. Are you trying to figure out what moves you need to make to survive and thrive in the new COVID economy? I want every health innovator to find their most viable and profitable pivot strategy, which is why I created the COVID Proof Your Business Pivot Kit. The Pivot Kit is a step-by-step framework that helps you find your best pivot strategy. It walks you through 6 categories you need to examine for a 360-degree view of your business. I call them the 6 critical pivot lenses. As you make your way through this comprehensive kit, you'll be armed with the tools, tips, and strategies you need to make sure you can pivot with speed without missing out on critical details and opportunities. Learn more at legacy-dna.com/kit. We've talked a little bit before about, these differences in how maybe you position your solution as well as your marketing strategy, that when you are marketing something where the problem is very mature, that you market it very differently than if you are trying to market something to a target audience that doesn't even know that they have a problem yet, and then having to educate that market. So just kind of talk about your experience a little bit with that. Maybe there are some pieces in your offer that were problems that people were looking to solve for, and maybe there's some pieces that you had to educate the market, or are educating the market around. Yes, this is a problem and it is solvable.
Yeah, we completely went through that. So, again, pre-COVID, the conversations that I was having with pharmacy customers, with investors, with people in general, it was all around the value of telemedicine and remote diagnostics. To your point, we were educating at that time an entire market of people who had never even thought get care in this way, right? They never saw their pharmacy as a place where they could pop in and get on their phone and use this test. And so we had the burden of educating about the model, about the value of the model. And I think at that time, when we talk about marketing strategy, the real, one of the most salient things that we had to figure out was, because this wasn't, we'll say, yet a hair on fire problem for patients. Like, they didn't even realize what they were missing out on yet, because we were still in that education phase. Yep. We had to figure out a way to get in front of the right subgroup of patients who was going to more immediately need our services, our products and services, so that we could increase the likelihood of the conversion, right? Because unless you get anyone to the conversion point of being like, this is amazing, they're never going to then be able to see the value, and they can't be advocates to their friends and families. And so there's no network effect without that early adopter group. So I think initially our marketing strategy was really around, how do we get in front of the right people at the right time? And again, this was part of why pharmacies were such a great partner for us, because as a consumer, as a patient, if you have a sore throat, many times where do you go to get a throat spray or a cough drop? You're going to your pharmacy. So being able to get in front of that patient at the moment where they're going to need us most increased the likelihood of conversion.
Them going to the pharmacy is almost like them going on to Google and searching, right? That's that purchase intent to purchase. Exactly
right. That's exactly right. We had to figure out a way to find, in a cost-effective manner, because we were a startup, how do we find those with quasi-immediate intent to purchase? That's, yeah. Mm-hmm. And, then what changed with COVID, so COVID then was like, duh, telemedicine, duh, use your pharmacy. So we didn't have to educate as much anymore. Now we had a much broader captive audience that's like, yes, I'm looking for an opportunity like this. I want to get care in a more efficient, cost-effective way. But then what shifted was there was all these new entrants into the market. So whereas we had been thought leaders pre-COVID, now everyone's in telemedicine. And so then the marketing really changed around, well, how are we different and better? What exactly are we doing? It's we don't need to educate you anymore on the value of this entire sector, but how can we educate you on how we are uniquely different than the other options you have now?
And to be able to sense that change in the market and then be able to be agile and nimble enough to be able to adapt your marketing strategy and message, I think is really critical. Being able to stay close to the customers and hear what they're saying so that way you can, even make those little pivots within your marketing strategy.
One of the things that we did around that specifically, we created at the beginning of this year was a pharmacy advisory board. So, we're a B2B2C model. We sell our products and services primarily to pharmacies. They resell them to patients. So we got a dozen or so pharmacists together who represented different, again, parts of our reality, some that were overperforming, some that were underperforming, some that weren't even customers yet. But they represented certain types of communities where we wanted to be successful. And we convened them once a month to essentially ask them about things like this. What are you seeing that we're not? This is what we're thinking. What's your feedback? So some sense of evaluation from someone who's going to be the end user, or at least the intermediary user in the process.
And was that valuable? Was that something that you were able to glean some insights from?
Yeah, it took a little bit of wrangling to get things up and running, but once we did with consistency, every one of those conversations, some real pearl of wisdom comes out of it. So yes, I would say it's really been not only immensely helpful, but way more efficient. We always make customer calls like to our pharmacies and stuff, but it's a lot harder when it's kind of piecemeal like that. This was like a very organized way to rapidly assess the iterations that we were making.
Sure. So what are some of the other lessons that you've learned along the way in this journey, whether it's been some of the entrepreneurship courses that you've taught, or whether it's been that real world experience of being in the trenches? As we kind of start to wrap up here, are there any other lessons that you've learned along the way that you would want to share with our audience?
Let's see. I will make, I guess, two comments. One is around mentorship. So I think every phase of your company's development will require and demand different types of mentorship. So understanding exactly in a very, very tactical way, what is it that your company needs to move from point A to point B helps you identify who the actual experts are in doing that. And those are the best targets for mentorship. I think a lot of times, especially in the early stages, mentorship is more of it's a relationship. It's a motivational relationship, and it's a little bit more cheerleading. As things go on, I think most of us need maybe a little less cheerleading, but a lot of tactical guidance that can shorten the learning curve, because that's part of the game. Is how do I learn how to do this from point A to point B as quickly as possible? And I think one of the best ways to do that is with the right types of mentors. And then the other thing that I've learned that I try to say as often as possible to be motivating is people often ask me about what the formula is for success in this world. And I'm still trying to figure it out myself. But I do feel fairly confident that there's no secret sauce. A lot of it is just believing that you have the ability to figure it out. If you have surrounded yourself with the right team, that collectively you can figure it out. To me, that is, the majority of the battle.
Yeah. I think you bring up a really good point of the experts or the mentors that you surround yourself with. So your advisors will change, right? As like what you're saying, evolve as the company grows into different stages, as well as those and maybe even investors, the folks that you actually hire within the company. A lot of that will change because the skill set and the pace, the knowledge that's required in the beginning changes over time. And sometimes those people are, tried and true, and they've kind of built businesses, through all of the entire steps of inception to, this repeatable revenue model, and high scalable growth. And sometimes they haven't. And so being able to sense that and being able to say, it's been a great ride with you this last 6 months or this last year, but we need something new. We need something different to take us like at this new destination, this new point or step that we're going to. I think that's really great wisdom to share with everyone.
And I read this article once, I think it was, I don't know what Harvard Business Review, is about Netflix and their approach to performance improvement and just tenure at a company. And it really changed the way I saw this concept. And it's exactly what you just said, is that everyone should look at themselves and their team, and you're being brought here for a reason. And I want you to crush it at that reason. But once you do, if that reason is no longer relevant, everyone should feel like the goal was accomplished, and then it should be this compassionate moving on. Not so much that anyone's being phased out or unappreciated anymore, but it's more about, like you said, every phase of the company's growth will have a different need, and you have to be true to that need and true to the people who can address that need.
And it's interesting. I think that even goes for ourselves, right? As the founders, co-founders, or CEOs of the company, that, this kind of like scrappy hustler, comeback artist kind of attitude and ability, that is so invaluable in the early stages of a company, might not necessarily be what the company needs from their CEO when they're 15, 20 years in, and they're looking at that, exponential growth or scalable growth later on. I just have someone I was talking to, and they founded a company, they built it, they're very proud and a lot of success, and they've been leading the company for 17 years, and just recently decided to become part of the board still, so still incredibly involved, but recognize that they're no longer the best person to be the CEO to take the company to the next level. And that is got to be very, very difficult and very humbling, but also something to really admire when someone can come to that point.
And I think it goes back to believing that the team, and the team includes you, right? You're always doing the best that you can, but you want to grow in that role to the point where you've sort of made yourself, you've outgrown your own skill set. And you're right, there is a lot of humility that has to go into that, but I mean, the statistics show, I think it's less than 5% of founders who go from, day one to IPO. And so I think if we can at least just use that and say, listen, I'll be thrilled if I'm a statistical outlier, but if I'm not, that doesn't mean I haven't done my job as a founder and an early stage CEO to the best of my ability. And I haven't done a successful job. It just means that that's where I shine. This is where the team shines. This is where the company's going. And now I want to bring the right team in to shine at this next phase. So I absolutely agree with you.
And it's so much easier to have that conversation with someone else that's on the team than to look in the mirror and have that conversation with ourselves, right?
Although I will say, sometimes when I'm trying to talk through this with my own team, using myself as an example, I think it at least shows them how this is kind of a universal truth. Right. I'm not telling this to you. I'm not dictating it at you so that you this is something that might happen to you. It's hey, no, this is what we should all be aspiring to. That we, like I said, we crush it so much at this phase that the next phase we're passing the baton.
So what is ahead for Physician 360 in 2022?
So we will continue to march at our vision, which is that we're creating, the largest network of affordable care clinics in the country by transforming these pharmacies. So you will continue to see us in more and more communities, as we continue to grow our footprint, overlaid in their footprint. There's a few other, conditions that we will probably start to pay more attention to once COVID normalizes a little bit. But ultimately, we will be able to service just about any urgent care condition that you would otherwise have gone to an urgent care for. So I think be on the lookout for some fairly creative ways of doing things as far as, getting imaging studies done or things of that nature. That's really where we're headed.
Awesome. So how can folks get a hold of you if anybody wants to follow up with you after the show?
The best way is probably through LinkedIn. I'm on LinkedIn. You can also go to our physician360.co website, and you can find contact information for me or anybody else on the team there.
Awesome. Thank you so much for joining me today. It's been great.
Thanks, Roxy. Appreciate it.
Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and attention. To get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who shared the show with friends and colleagues. See you on the next episode of Health Innovators.